Hi, welcome everybody to the Wednesday webinar. As you maybe have understood, Wednesday webinar where we are going to introduce our international school. I'm here with Carla. Carla, good evening or good day, depending where you are, from which part of the world. It's always a pleasure to be here to introduce and present to all over the people all over the world our international school. As you maybe know, we are the fifth generation edition of the school, so the English is getting extremely popular, in way more for the Italia. We are way more editions still. 10 years that we are running the Italian version. So tonight we are going to introduce a little bit what is the school in relation to the method, what is the advantage of the school, but we'll be happy to answer any specific question that you maybe have at the end in relation to what is the advantage of the school, or maybe the difference between the school and the course. So we will talk about that. So ideally we will take like a 40 minutes, 30-40 minutes to present, and then feel free even during the presentation to write down any question that you maybe have. We'll be more than happy to answer at the end, and try to give you all the information that you maybe need to start to better understand this very interesting program and possibility that we are going to share with you in this long journey. So let me pull up the presentation. So the school, as you know, is everything based on Luigi Stecco work. Luigi Stecco is the founder, by the way, is our father. He's presented this concept since his thesis, more than 50 years ago, and year after year have strengthened his concept, his idea. It become from a hypothesis mostly thesis, because now there's a lot of publication books and not at the last result that show how this concept that 50 years ago was really a pioneer vision of fashion, now become the real start from a few course. Now we have all the 4 course. We have the master class in the school. It's a long journey that allows us to present all this material worldwide. So let me introduce myself if someone have not had the opportunity. I'm Antonio Stecco. I'm a medical doctor. I'm a physiatrist. I'm assistant professor in New York University, but I work, here and there between the Atlantic Sea, ocean. So my major is research in clinical, the role of fashion in clinical practice. So I'm running a few grants with a couple universities, John Hopkins, George Mason in US, and it's really interesting to see how the community of myofascial pain is growing, and in particular after opioid crisis, there is way more interest to find out new opportunity, new possibility to treat pain, and and fascial manipulation is getting the way to try to fill up the gap, this empty space that is now present worldwide to manage pain or to understand the origin of the pain. But this evening there is also Carla. Carla, if you want to just introduce yourself.
Of course. So I'm Carla Stecco, and I'm orthopedic surgeon, but I'm above all a professor of anatomy at the University of Padova. And my journey in fascia started when I was young, because I always heard my father to speak about fascia But during my school, nobody spoke about fascia. During the resident period, nobody spoke about fascia. So I was curious to understand more if really the fascia could be a matter for the research, for the clinical practice, or it was just a creation of my father. So I started to be interested above all in the basic research. And my first paper was about the innervation of fascia, because until that paper, nobody was awake that the fascia have a huge innervation. And my doubt was how my father can affirm that fascia play a role in pain, in motor coordination, in proprioception, if nobody know if are innerved or not. When we found the innervation of the fascia, I say, okay, maybe my father is right. And I started to go deeper and deeper in the knowledge of fascia. So now I published more than 250 papers, different books, the Fascial Atlas, that is the first photographic atlas about fascia. And I have much more knowledge about the fascial anatomy, fascial physiology. And now I can tell you with much more strong that surely fascia can play a role in the pain perception, in the motor coordination, and we need really to check and to treat fascia in our patient. I think that in the assessment of a patient, forget the fascia is like to forget the stomach when we want to understand the digestive process in a patient. There is a missing point, there is something that can't fit really, and we can't understand really how work the digestion if we ignore the stomach. Is this the same with the musculoskeletal system? How we can understand the movement if we forget the fascia, and how fascia give insertion to more than 30% of the muscular fiber, if are more innerved with respect to the muscle. So there are many elements that really push me to go deeper in the understanding of the fascia, and we invite you to take this journey. But really is a journey, because if we think about the evolution of fascial manipulation, I can tell you that is a very long history, and how we are now is just the end of a very long process. Here you have the first book that was published by my father in 1983. And in this book is only in Italian, and is called Myofascial Sequence and Acupuncture Meridians. So you can understand how from the beginning my father had the concept to connect the meridians with the fascia. And also he speak about that ipsodirectional muscle insert sequentially onto their overlying fascia. And consequently, it creates the fascia work like a bridge connecting different muscles that are working for the same movement. This is the basis for the motor control, for the motor coordination, and for the proprioception. This was really one of the first concepts of fascial manipulation, and after 40 years, we can confirm really such a description. But nobody take care of this small book in Italy, so my father decided to move to participate to the first international symposium on myofascial pain that was in Minneapolis in 1989. And there he presented his idea about how trigger points are vector formed by all the muscular traction operating into the fascia. So it's the first concept of a center of coordination. And again, it tried to combine the concept of a trigger point with the fascia, and that is still a question. In almost every course, I have the question, but what is the difference between a trigger point and a center of coordination of fascial manipulation? You can see that are 40 years that we are discussing that, and I think that really are two aspects of the same coin. The trigger point is more inside the muscle. The center of coordination is where the tension coming from the different muscle fiber converge into the fascia. And this was really the first book that was started to speak in a more precise way about fascial manipulation as a manual technique, because in this book was clearly defined the treatment process with data collection, hypothesis, assessment, treatment verification. So you can see that this precise organization that we can find in the fascial manipulation was described in this book, and also my father reinforced the concept of myofascial sequence. In this book, we found also some concept about how the visceral dysfunction can affect the musculoskeletal component and how we can really assess a patient in a very global way, because the locomotor system can affect the internal dysfunction and the contrary. That is something that really I like of fascial manipulation, because allow me to understand better the patient, putting together in the same assessment all the information that we have, not dividing the patient in different parts, as we are used to do in the Occidental medicine. But fascia is the link that connect all the different parts of the body, and consequently an internal problem can affect the musculoskeletal, can affect the skin and the superficial fascia, and we'll see also the brain and the psychological component. And then he started to be more and more precise in the to define the modality of treatment, but also before it spoke also about the innervation of the fascia, that we need to release the nerve inside the fascia. Now he will focus more in the fascial rugosity. And he underlined how is important a specific manuality to treat the fascia. We need to look for the rugosity of the fascia. It's not enough to look for a muscular rigidity. So my father started to be more and more focused how to explain the manuality of the fascial manipulation. And in this book, we have the first organization of the biomechanical model of fascial manipulation, with the description of the 6 myofascial units, with a center of perception and a center of coordination for each myofascial unit, with the connection of the myofascial unit with the 3 plane of the space with a specific movement. So that is the biomechanical model that is so original. And really, at the beginning, I was not convinced. That was the idea of my father. I have not to trust immediately in this idea. But the more I study the kinesiology and more I have to explain the kinesiology to other people, more the biomechanical model that was presented in this book, I think that can really open the mind and can explain the movement much better respect the classical kinesiological model. And here we have the expansion of the biomechanical model. And we start really to have a more holistic approach of fascia manipulation. We started to speak about how fascia play a role in the postural control and how they interact also with the proprioception. In 2004, we have the first English edition, and in this book, we have the first histological photograph and the session that I started to do in Paris at the University of Padova. In this book also, we have the clear definition also of the diagonal and of the spiral. So we have like a second step, because until that edition, so you can understand that are 20 years, fascial manipulation was just the sequence, just the CC. Only in 2004 we started to speak about the center of fusion, the spiral, the diagonal, the complex movement, because my father understood that the sequence are more related to the postural control, to the static position, or to the basic movement. But when we need to move in a complex way, that biomechanical model is not enough. We need to understand the movement in another way, in a more complex way. And with the dissection, we understood that we have a different level of complexity. We have the sequence that work more in a longitudinal way with some longitudinal bundle, and we have the spiral with the fiber that go around the way to connect adjacent segment in the opposite way. And really we can see this different biomechanical model looking at the fascia in a precise way. And is what I'd like to do during the dissection, and I hope that you can see that dissection one time in your life. And then in 2007, we started to be more precise also in the practical part, and consequently we published before in Italian and then in English a practical manual showing the treatment position, the movement verification in a very precise way. So now we have really the fascial manipulation as you know, and we started to teach all over the world. Really, my father started to do the courses a little earlier, because the first courses started at least 10 years before this book in France and in Italy. But was with this book that we were able to go all over the world. And only 20 years after the first book that speak about the relationship with the internal organ, my father had the courage to publish this book about the internal dysfunction. It was the 2010. And I remember very well the first course with my father about the internal dysfunction, and how the participant was shocked by all the new approach, and by all such type of relationship, how we can really do something with in the internal organ, or how we can interact with that fascia. But after 15 years that I teach this course, I really think that we have improved a lot the way to teach, the understanding of this type of relationship. And now in my clinical practice, I think that I use this approach in more than 50% of my patients. Surely I have a pretty complex patient, but in the majority of the patient, this approach is very useful to evaluating a very global way the patient, the complex patient, when they have pain almost everywhere, and to find the line to treat the patient and to manage the patient in the proper way. And after that, we started also, a new book, a new part that was about the superficial fascia. The superficial fascia is the new topic. I'm involved in the research about the superficial fascia in the last 10 years. And when I started to discuss about the superficial fascia with my colleague 10 years ago, the people say me, oh, superficial fascia don't exist, it's just an artifact. But now all the people trust that the superficial fascia exists, that we need to understand more the superficial fascia. We know that the superficial fascia is also more innerved with respect to the deep fascia, has a lot of autonomic innervation, and interact with for the thermoregulation, for the lymphatic drainage, for the superficial vessel, the fat tissue. And really, the superficial fascia sometimes can help you a lot in the management of the patient. Recently, I was also involved in the master for the lymphatics because the majority of the lymphatics are in the superficial fascia, and we demonstrate that. But will more I go deeper in the understanding of the superficial fascia, more I think that really is another important piece of the puzzle to understand our patient. So in this picture, you can see how the knowledge of fascial manipulation grow in the years and how the book are followed this understanding of the fascia and the growth of fascial manipulation. So now we have 4 different levels of fascial manipulation, level 1, 2, 3, and 4. We have a book that are for the clinical science and basic science. And is for that reason that we decided to start this journey about the school. Because in the past, we have so small knowledge that in a course was enough to give all the information. Now, the course is not enough. We have much more knowledge. We know more both about fascial manipulation and about the basic science of fascia. And for us, it's a pity to take this knowledge only for us. We want to share as much as possible because we really think that fascia could be the difference in the management of the patient. And consequently, I strongly support the fascial manipulation school because I think that is really a great way to understand all the process that me, my father, Antonio, have done in the last 40 years. But I think that now Antonio can go deeper in the organization of the school and why we are here.
And why we have to study fascia, because really looking around about publication, the number of new publication about fascia are growing exponentially. In proportion, they are getting more fascia connective tissue than the new about the muscle. So there is a really worldwide increase of interest about this tissue. And again, we are part of the pioneer group that are doing that. So we are in the scientific committee of the Fascia Congress. We are in the scientific committee of low back pain. So we are inside. I was the president of the International Myopain Society. We have already hosted twice the International Myopain Society. The first one was in Minneapolis, and now even the next one, 2027, will be in Padua. So the last 3 International Myopain Society Symposium were and will be in Padua. So I don't want to say Padua is the center of the world for myofascial pain, but we are working on that as well with the winter school and what is necessary. So I mean, Padua, we will see that is have a very ancient, a very great name about medicine. The beginning of medicine, people say it started in Padua with the first anatomic teacher. with the first test atlas of anatomy, the Vesalius, was done in Padova. So, the great history of Padova, the 800 year of the university, I think, it can be a good, combination in a perfect location for our school. We say that, people really appreciate the place. So, fascial manipulation, as everybody said, is basically is a method. It's a method that over time have developed and find out a way to assess, make diagnosis and treat patient with multiple dysfunction. So publication help us a lot. So we know the publication of our group, are growing up exponentially. This help us to enter in different academic, universities. So we are part of the curricula of University of Southern California. We are teaching other universities in the US. For instance, we are giving elective course in John Hopkins to all the practitioner or wherever they want to go in depth in fascia, but as well a lot of institution in Europe, in Asia, in China. We are getting a lot of recognition. We get also some support from local government. So this is really important because since 2021. Fascial manipulation was able to reach the level of evidence. We're talking about low level, moderate level evidence, really way more than typical manual therapy that have no evidence at all. So it was really a long journey, a lot of randomized controlled trial publication in order to get this milestone, target. And we believe it is not enough. We need more because still at the worldwide level, manual therapy is not so much taken consideration, even if many people see the result, they appreciate the result. So we want to keep this high standard reputation, and we believe that this reputation will pay back. It takes so long time to get to evidence, but now be in the top 5, top 3 method is really a great opportunity for us. And as I said, this is like a method. It's not just a treatment, because people love around the world the way that we assess the patient. And maybe why not? They use this method to assess, and then they apply the shock wave, they apply the needle, they apply injection. But it's the combination, the location of the point you're going to inject, you want to needling, you want to apply shockwave, that make the difference. So we understood that through our biomechanical model, you can better understand how really body works. That because we are more sophisticated what look like. All the myofascial expansion, all the fascial continuity make the different body segment more in connection in a way that is not really represented by muscle. A lot of time, the muscle are not enough to explain the transmission of force. Why not? The spread of the pain. How many times even Travis Simons were not able to describe or define why pain was spreading in that specific direction? It was outside the border of the muscle, far away from any dermatome. Fascia can do that. So through a clear anatomy and then physiology and then pathophysiology, you can really understand why patients are suffering and why we can really improve so many conditions. Of course, you need a biomechanical model. It is a simplification of the human fascial system. Biomechanical model for musculoskeletal, biomechanical model for the visceral part, and biomechanical model, why not, also for the superficial fascia. So through our network, we are giving worldwide more than 10,000 hours of education a year. We are more than 50. We are 60 countries right now worldwide. We train more than 3,000 participants every year. So we are extremely excited about where we are. This is a map that explains most of our country, but it's still underestimated because we have a few new countries that we should add. But what is important for us that look, we are teaching all over, but we are teaching at each level. So low income country, middle income country. So you see, Ethiopia, Kenya, Philippines, Paraguay, just a few examples that we were really, did our best to go to teach, maybe in country where it's really hard to get there. But this method can be applied in any place. It doesn't matter. It's not costly. So you just have to have your hand. So you can apply your clinic without any instrument. And even if your clinic is, at the end of the world, because when you have knowledge in your hand, you can do that. So this permit us to, of course, be integrated in a lot of university, so become elective course for the student, or postgraduate course or master course. So that, allow us to be, integrated in part of the curriculum of the student, but at the same time to become, one of the, more used method in many sport team. This is just few, I have to tell you, because for instance, in US, more than half of the MLB, so baseball team in US, they have took our course. They invite us to train the entire team, healthcare team, in a way that they can apply this method to their player. I have to say that all the players that they have a very sophisticated movements. I want to say baseball, tennis, golf, basketball. So all these players, they really need a perfect biomechanics, and this has to be applied. But again, we treat endless number of soccer players because also their ankle sprain, we prove that we can do sport injury prevention. So we publish an article that explains that if we treat properly the athletes at the beginning of the season, we can drop the number of the severity of the ankle sprain. So you don't increase just the performance, but you decrease of the injury during the season. So this is a really extremely exciting, extremely recent, project that a lot of team they are developing in order to keep healthily their player, to let them go through all the tournament up to the playoff in the proper shape and to perform at the best. So of course with the school you can have a 360 vision of this problem, because maybe the shoulder problem can be a simple deep fascia, maybe is due to a reflex pain, a referring pain from the visual organ, like could be like a stiffness from a previous pleuritis, but can be also pain due to the superficial fascia that may be aggravated when it's sleeping over. So the same myofascial pain, the same non-specific musculoskeletal pain in the shoulder can have three origins, and through our process we can apply the proper tool, the proper manuality, the proper depth to treat that kind of symptom. So again, it's a method, and this method have a multiple tool inside. So that is why when we talk about fascial manipulation, there is different way to approach fascia, because there are different type of fascia. Each of them have the same name, but have completely different morphology, histology, innervation, disposition in the body. So all this information is critical, because when you put the hand, the depth matter, the gliding matter, all this information, if it's not well digested, it will, impair the quality of the result. So the school was required by the students. So students are looking out, we want to be followed more. It's not enough, of course. We want that you follow us. We do observership. We want to do dissection. We want to, stay together, make a journey, and get all this information. This is why we set up the school, of course, before in Italian, But now, we have already completed the first international school. We are running the other 3 right now. So we see that the international school is really an incredible opportunity to people to get together, and why not to get the information from from the source, let's say. Um, the international school, of course, will be in English, and for logistic reason, will be hybrid. So the school is 3 year, like the full on-site Italian edition. But the difference between the Italian and the English is that the English is hybrid. So we have pre-recorded online lecture, we have live webinar, we have on-site part, we have observership, we have dissection class. So how all of this is organized? So you will have during the whole 3 year, roughly every month, few hour of pre-recorded lecture that you can watch at your time and watch again as much you think is necessary. Then at the end of that month, there will be a webinar, a live webinar with some specialists of that topic that will present a new topic and with a PowerPoint lecture. It will open up a discussion to review the entire concepts that were presented during the pre-recorded lecture. That will open up a discussion and will try to answer any question that will be necessary. From there, we'll start another pre-recorded lecture. And this pre-recorded lecture will go ahead for another month. And after that, will be another live webinar. We will meet together 3 times a year. Will be March, June, October. So these 3 times a year, everybody will come in Padua. We will have Thursday, Friday, Saturday, and Sunday, and Monday. So Thursday, Friday, Saturday, and Sunday, there will be all practical part. It will be like an opening lecture, and then will be all hands-on, fully hands-on, because we'll use at the best the time that you are in Padua to really increase your skill to practice. And to further, get in depth in practical, on Monday, you will have observership. So we will split you in small group in the way that you really can do and can be, you can observe it, you can do the treatment by your own with supervision. So that will be a really the excellent opportunity to get really into the material, into the clinical practice. So the online lecture normally are roughly 4 hours each time. Okay, there will be a dedicated platform. So you will have a endless, opportunity to go in the platform. Inside the platform, you will have all our article, listed by years. So you can see the reference, looking for the article, get in depth and read the entire article. That would be extremely, unique opportunity to, expand your knowledge on that. And of course, the practical, will be divided in these 3 parts. During the on-site, there will be 2 opportunities of this dissection. So on the Padua University, we'll do a dissection class where Carla and me, we will go layer by layer and we'll try to explain and describe and show and let you feel, how fascia look like, how fascia feel. Because only when you really see a real, continuity of the fascia, only in that you can really understand how wide, how important, how well represented is this tissue in the body. And from there, you will see that everything else will start to make perfect sense, because unfortunately, most of the atlas, they remove the fascia for technically clarity, but in reality, they impair the capacity of learn and understand the content of our entire body. So the first year is mostly related to teach the central coordination. So we'll talk about plane, we will talk about strategy, we'll talk about flow chart, we'll talk about assessment chart. So that will be like the core of the first year. Second year, we will start to introduce the central fusion, diagonal, the spiral, to more motor gesture, complex gesture. And we start also to talk about not just deep fascia, retinacula, but we start to talk about also the visceral fascia in the second year. So what we call tensor structure, catenary, pivot distal point, a global dysfunction. You will have an endless number of patients that it seems that they have a clear heel pain, knee pain, elbow pain, but in reality it's a referring pain from visceral problem. So if you don't detect that is a referring pain, you will struggle to keep treating that heel pain, that knee pain that you believe is local, in reality is referring. So that will generate a lot of frustration because the patient will keep coming back with the same pain. In all the specialists will be, will fall to find out a solution. So get already this information second year will help you to try to recognize this patient and treat properly. And of course, on third year, we'll talk about superficial fascia. So all the lymphatic immune system disorder, so from lymphedema or lymphatic stasis, the allergy the metabolic system, so people with painful cellulitis, alteration of the subcutis, we'll talk about thermoregulation system disorder, so people that have alteration of like a renal, but also CRPS, people that have alteration of the skin, dry skin, or problem that will get to our last frontier, psychosomatic and somatopsychic disorder. So you will see how much the psychological part can compensate in the fascia, both superficial, deep, and visceral. So the psychological stress can generate what we call densification, but we want to see also vice versa. There will be an incredible number of patients with panic attack, anxiety, and many other major psychological problems that have a somatic origin, a fascial origin. In that case, you can really do amazing because you will really change the life of this patient also from a psychological, social perspective. So we will give you credits. So we will do continuing medical education credits. Is the European Accreditation Council continuing medical education. So we are accredited agency to provide credits. So this credit is automatically recognized by all the countries that you see here in the slide, as well are automatically recognized by the American Medical Association and the Royal College of Physiatry and Surgery of Canada. So it's means that they are just straightforward recognition of these credits. So we know that CME are very important. That is why we have decided to give you 60 credits on the first year, 60 credits on the second year, and 90 on the third year. So I believe that some of you will be set also for the fourth year with that amount of credits. So, the credits, we saw that, it give you like a great opportunity to really think about it. This could be like your teaching career, your education career for next 3 years, because that will satisfy the requirement. At the end, of course, there will be the opportunity to become certified fascial manipulation specialist. So at the end, of course, we will wrap up all the information. There will be like a practical, hands-on in discussion, exam to, finalize all the information that you have acquired and, give you the title of certified fascial manipulation specialist that, will be listed in our map. We have a map with all the specialists already certified in the world that will facilitate you in the patient as well to be found and to permit also our headquarter to address patients that are required the method to healthcare professionals that have the skill to treat properly the patient with the fascial manipulation. So this is just the picture of this weekend. So we have the first on-site part of the new international school 2025-2028. So it's really have just a few days. So it's sold out school because we have really 40 participants. Even here we have all the 5-7 continents. We have Oceania, Africa, Asia, Mid East, Europe, North America, Central America. So it's really amazing to get all these people from all over the world all together. It is really a special event. It is a possibility to exchange, get friends all over, be in contact, and spend great time in Padua. So everybody love it to be to spend time in Padua. And of course you can see a few of our teacher, but during all the school you have the opportunity to meet in person our teacher, because every time that we have webinar, there will be a different teacher as well. On site you will have a different teacher, so you will see the skill of all our teacher, and all our teacher have their own experience and their own specialization. So in order to have more information, please feel free to write to info@fascialmanipulation.com. Our institute is based in Padova. Padova is north of Italy, close to Venice. I have to say that everybody appreciates it because it's really easy to be reached. We have the international airport of Venice that is 33 minutes by car, half an hour by car. We have direct flight from US, Canada, Mid East, Asia as well. And there is a bus train that from the airport bring to Padua downtown. We have also Treviso Airport, Venezia Treviso Airport, that is still very convenient. It's like 40 minutes by car. And we have mostly European low-cost flight. So it makes it really cheap also to fly to our area. These are the two most convenient airports, but in an hour, a little bit more than an hour, you can have a Bologna airport. In more than an hour, you have a Verona airport. In 2 hours and a half, you have a Milan airport. So there are a lot of connections that allow you to reach Padua easily without much problem. Talking about tuition, the cost is 2,300 euros a year. It can be also paid in 2 installments. These include the online lesson, the on-site lesson, the training material. So all the practical books are included. Internship, the dissection, it will the anatomical department of Padua University will be included. As well will be included the social event. Every time that you will come in Padua, there will be a social event. We will visit a part of Padua. We will have dinner together. So we will take care of transportation, tickets, dinner, and everything is included in this tuition. So you will have a nice social event including this tuition. So it's really, I think, special, and we really take care of the social event because we know that Padua is lovely place to stay. Is it has like a 60,000 student, is very young and active life city. So so far, if you get the chance to ask to other people that were in Padua, they all appreciated like the nightlife in Padua. So that is why we are really looking forward to see you in person in March 2027. But as you know, the school will start in October 2026. So the registration are already open. You have to submit your CV, and the scientific committee will review your CV. So the school will start in October with the first webinar and the first pre-recorded lecture. But then, yes, the on-site part will be in March 2027. So some time to think about. Technically, we will start to close before summer the registration in order to organize all the class properly. If you are thinking about, please feel free to write to info@fascialmanipulation.com to have more information. So thanks a lot. We keep in touch and looking forward to see you in the next future. Bye,
Bye
guys.
bye.